Today I'm going to talk about brachioplasty. That's those bat wings, bingo wings that hang down. They're worst if you've lost weight. They're bad if you're skinny and you put your arms down and you see those vertical lines. There are many different ways of tackling them, but we start with a simple one. If you're just a little bit tubby and you've got slight hanging down arms, liposuction alone does help. You have to use small cannulas because you don't want to leave any little channels behind. That's number one. If you've got a little excess skin, you can make an incision vertical in the armpit that pulls the skin up. But in my experience, that doesn't really work very well. It doesn't give enough difference. So finally, if you really have significant prominent arms, sagging arms, then you need a scar. And unfortunately, we excise the skin like this into your armpit and stitch it up in a single line. And I think it's important to see that there is a scar, but it is hidden on the inside, so no one would see it initially. Of course, as time goes on, which is 6 to 9 months, the scar goes pale, soft and silvery and is virtually unnoticeable. The huge advantage, of course, after the operation is you can slip into your clothes, into dresses and things easily, without that skin hanging down. Sometimes, if you've got some excess skin where you put your bra on and you've got a little hanging around the axilla, we can make the incision go down to the armpit and down a bit here to grab that bit. In other words, to remove the bit that hangs over your bra. But these are all, everyone's different, so you need a consultation to decide which is the best way. Just a few points about surgery in general. We like to be safe. I always operate in a very safe environment, whichever hospital I choose. A real anaesthetist, proper instruments, proper stitching up, and proper preparation. And in the bat wings, the brachioplasty operations pre-op is lots of care with sterilisation. In other words, we give you the pink stuff that we surgeons use, chlorhexidine, to wash our hands in the surgery, for you to wash your armpits and arms in for 4 or 5 days before the surgery. This really does help any small infections. Secondly, once the wound is stitched up with a dissolvable stitch, I like to put glue and then tape on top to completely seal it, so that you have the dressings are therefore very easy, but they're safe. I find it better to do most surgery under general anaesthesia when my patient is asleep and I've got full command of exactly what I want to do. It is possible for small areas to have it under local anaesthesia or local anaesthesia with sedation, but you would have to be absolutely the appropriate person for that. And again, it's something we discuss. Immediately post-operatively, we have a tubey grip bandage around your arms to give some support. But in some ways you don't completely need this if you can wear a firmish lycra sort of cycling garment. For 3 weeks the steri-strips stay on, and then we take them off and put another thin layer on for another month or so. Basically, you can get back to work from this operation after 3 or 4 days, but wearing appropriate clothes. But it does take 6 to 9 months for the scar to go from red to pale, soft and silvery, so that you can show it, for instance, in a bikini. If you're interested in this procedure and you'd like to know more about it for you, then please phone my secretary and make an appointment.